I'm Julie Williams. Before COVID-19, most people had to travel to the doctor for a health checkup, but the pandemic changed that. A lot of providers turned to virtual or online visits. My co-anchor Mark Kiesling talked to local providers about the popularity of telemedicine.
Julie, during the pandemic, telemedicine saw a significant spike. Take a look at these numbers. In April of 2020, virtual or online visits were 78 times higher than they were in February of that year. During the spike, 32% of all office and outpatient visits were performed virtually. Since that spike, telehealth visits have scaled back to a level of 13 to 17%, but are still more than 30 times higher than pre-pandemic numbers.
COVID-19 made us rethink habits and practices that we relied on for years, even a routine doctor's appointment. Many of us learned to check in with our medical provider through a computer screen or other device.
They found that virtual or telemedicine was a safe, convenient, and affordable option for many of their healthcare needs.
Allison Thorne is the director of Express Virtual Care for SSM Health. She is also a nurse practitioner. Thorne says patients soon realized the benefits of virtual visits.
People can have these visits conducted at their home, in their office. I've had patients in their car, not driving, but patients in their car on lunch break.
Online appointments save time, gas money, and lost revenue from missing work. They also eliminate concerns about weather conditions or travel.
Especially if patients have mobility issues, just can't get out or don't have access. They live in a rural area. You know, the telemedicine world has really reached them to where they may not have been receiving as much or any health care prior.
Thorne says doctors can treat a variety of ailments through telemedicine, like sinus infections, allergies, and more.
You can do rashes, bug bites, minor injuries, bladder infections, certain medication refills.
They also help prevent the spread of viruses and infectious diseases.
We really try to utilize the video visits for anything that could be contagious. So flu, COVID, we really utilize them for that so that we don't expose others to something that could spread.
Dr. Mark Cordy of SIH is a family medicine doctor. He too saw an increase of virtual visits during COVID-19, but he says there are some aspects of in-person medical care a virtual visit can't provide.
There have been occasions where I have seen something in the patient that they don't report to me, that I never would have seen by video. Something different in their gait, something different in a mannerism, just something different about them that can only be seen in person.
Dr. Cordy says there's a relationship that's built through in-person visits that is often lost in a virtual setting.
There are times where people truly need their hand held. There are times where they just need to work through a tough situation. Doing that through a video visit is not the same.
Thorne and Cordy agree there are some medical conditions that require in-person treatment, including injuries that may need x-rays and emergency situations. Despite those drawbacks, telemedicine is proving to be more than a trend. It's likely to be a big part of medical care in the future.
Yep, patients have really taken a liking to the virtual type of care, especially the convenience and the cost.
I do see us utilizing it more. It'll never replace what we do here in the office.
If you do choose a virtual visit, there are some things to keep in mind for a better experience. Use a quiet place where your doctor can hear you and you can hear your doctor. Make sure you have a location with good lighting. Avoid a harsh light or open window behind you. Make sure your device is charged or plugged in, and close out other applications so you won't be interrupted during your visit.